You're listening to the MotherToBaby Podcast, medications and more during pregnancy and breastfeeding. Ask the experts with your host, genetic counselor and mom of four, Chris Stallman.
This episode contains evidence-based information that's current as of the day recorded and may change as more data becomes available. Also, quick disclaimer. The opinions shared by our guests are their own and don't necessarily reflect the views of Otis MotherToBaby. To get the very latest information about this topic or other topics in pregnancy and breastfeeding, please contact a MotherToBaby specialist at 866-626-6847, by text at 855-999-3525, or through our website at mothertobaby.org. Welcome to another episode of the MotherToBaby Podcast. My name is Chris Stallman, and I'm a genetic counselor, a mom of four, and a teratogen information specialist. So what that means is that I talk to people, so patients, providers, family members, and the general public about exposures that can happen before pregnancy, during pregnancy, while breastfeeding, and in cases of adoption. And an exposure can be anything. So it could be a chemical at your workplace, or a medication you take, or sometimes a test that you get or a treatment that you receive. Our guest today is back to talk with us more about a really important and commonly asked about topic in pregnancy and breastfeeding: radiation. Dr. Emily Caffrey is the program director and an assistant professor for the Masters in Health Physics program at the University of Alabama in Birmingham. She is also a certified health physicist that specializes in calculating radiation doses from environmental sources of radiation, and is here today to talk with us about radiation and breastfeeding. Dr. Caffrey, welcome back to the show.
Thanks for having me. I'm excited to be here again.
Can you remind us a little bit about what radiation is and how people are exposed to it?
Yeah, absolutely. So radiation is just a form of energy, and there's really two types of radiation. There's radiation that comes from lights and microwaves and your cell phone. That's called non-ionizing radiation. Very common, your Wi-Fi router, things like that. There's also this kind of radiation called ionizing radiation, and that is the kind of radiation that can make charged particles, and it can ionize your cells. And that's the kind of radiation you get if you had an X-ray or a CT scan, PET scan, MRI, not MRI. MRIs are non-ionizing radiation. We'll talk a little bit more about that later. But so radiation's all around us. Radiation's natural. The Earth is radioactive. It's been radioactive since its existence, and radiation's been present, way back to the time of the dinosaurs. We live in a radioactive world. There's no getting around it. Earth is radioactive. Space is radioactive, and our human bodies and our cells have evolved in this radioactive world. Some defense mechanisms that we can talk a little bit about. So that small amounts of radiation that you get from this natural background are repairable. So radiation is all around us, perfectly natural. We add to that a little bit with CT scans and X-rays, and we'll talk a little bit in this episode about what that means for pregnant and breastfeeding women.
Awesome. Okay. So in episode 76, we talked about radiation and pregnancy. And again, that's something that we get pretty good amount of questions on over time. As you mentioned, procedures like X-rays or mammograms, in fact. So do procedures like X-rays or mammograms affect breastfeeding?
Yeah, that's a great question. And we get it at Ask the Experts a lot as well. So routine diagnostic imaging, X-rays, CT scans, mammograms, those do not require stopping breastfeeding. The radiation doesn't linger in your body or your breast milk. It doesn't make you radioactive. So once that machine is turned off, that X-ray is done, the CT scan is complete, there is no radiation anymore. Your body's not radioactive. Your breast milk's not radioactive. Your things aren't radioactive. Your clothes aren't radioactive. Those are on and off. So once that machine is off, there is no radiation. So no need to worry about any future problems with breastfeeding.
What about MRIs?
Yeah, and I'm glad you asked this because I almost said they were ionizing radiation. MRIs are big magnets. So if you've ever had an MRI, they're very careful. Like, do you have any metal in your body?
Yeah.
Because an MRI is a giant magnet. And so that is non-ionizing radiation. So again, those don't use radiation. So they are from the standpoint of, is it safe for you for breastfeeding? The answer is yes, totally fine after having an MRI to breastfeed.
Awesome. Okay. So also with things like CT and MRI, there are these contrast agents. Can you tell us a little bit about what that is and if the contrast agents affect breastfeeding?
Yeah, and I think that's a great question, because I think anytime you get injected with something, like, that's an area where oh God, what did I just get injected with, right? And then, absolutely. Exactly. So a contrast agent or a contrast material is just a substance that's used in medical imaging that helps make the structures in your body more visible. They highlight blood vessels or organs or tissues that are otherwise kind of hard to see. And so they're really helping with the diagnosis process. They temporarily change the way the X-ray or CT scan or MRI interact with your body. Now, not all contrast agents are radioactive. So the ones that are not radioactive, I am not an expert in, but based on the research that I have read, they do enter breast milk in very small amounts, but they are considered safe. So non-radioactive tracers, generally considered safe. You don't need to worry about breastfeeding your child. Now, there are radioactive tracers that are used in diagnostic procedures as well. Some examples are iodine-123, gallium-67, and technetium-99m. Those are all very common radioactive tracers. They're also commonly used in therapy. And I think one of the biggest things that you should take away, if you hear nothing else, is diagnostic and therapeutic. Diagnostic, small amounts, low levels of radiation. We're not concerned about the pregnant woman, the small child, or the breastfeeding mother, or the breastfed child. Generally speaking, if you hear the word diagnostic, that's low level, we're not worried. It's really when you start hearing therapeutic that those quantities of material and the radiation doses start to be, in an area where we want to think twice, in an area where we want to ask some more questions of our medical professionals. So again, if you're getting injected with a radioactive tracer, you're always going to want to ask, how much is going into me? Is it safe to breastfeed? Generally speaking, for therapeutic doses of iodine-123, gallium-67, and technetium-99m, there's going to be a period of time, depending on the nuclide and the amount of material they've given you, that you're going to want to pump and dump. But that's a question. So if you're being injected with something, ask. And if it's one of those three, nuclides in particular, or iodine-131 is another one that's really common in the therapeutic side. Anything iodine, we want to be really careful about, because iodine definitely goes into breast milk, and it concentrates in your thyroid, used for thyroid, very commonly used in thyroid, any thyroid issues you have. And it goes to breast milk, and you can imagine that a baby's thyroid is a very, very tiny little organ in their body, and so they can get a really high dose to their thyroid. So we want to be really careful with anything iodine. So definitely, if you're being injected with something radioactive, definitely ask. If it's diagnostic, probably fine, still ask. If it's therapeutic dose, that's a separate conversation with your provider about what's the best option for you. Typically, it's pump and dump for a day, 2 days, a week, maybe 2 weeks, depending. And then you can resume breastfeeding. But for some nuclides, you do need to permanently stop. It just depends.
And I'm so glad that you emphasized the ask piece of it. So at MotherToBaby, certainly we get questions about contrast agents, and very often it's the kind of thing where it's already happened, right? So now they're looking for what you said, do I pump and discard my milk? Can I continue to breastfeed? So absolutely get that information from your provider. There are guidelines. The American College of Radiology has information about, should you continue breastfeeding, or is there a waiting period? So there is information out there. So really, really important point, and I'm so glad that you emphasized it. Make sure you ask your provider, let them know you're breastfeeding, remind them, right? Because there's a lot. If you're getting one of these procedures, there's probably a lot going on, and it might be really easy to just, be wrapped up in that, which is completely understandable. But don't forget to remind them and ask them, I am breastfeeding. What do I do from here?
I completely agree. And I want to throw out there too that sometimes they don't know because radioactive material, it's a specialty, right? We're this little niche field. So if they don't know, it's perfectly fine to ask someone else at the hospital or have them ask their radiation safety office, reach out to MotherToBaby, reach out to the Health Physics Society. That's what our expertise is here for, is to help.
Absolutely. So diagnostic, a small amount, still ask, but a small amount. So something like a PET scan being a diagnostic tool, that would be considered a low exposure. Is that correct?
That's correct. Yeah.
Okay. What about treatments like external beam radiation? So as you said, therapeutic treatment, that would be a bit more of an exposure and maybe a different conversation?
Yeah, and I think that's a great question, because when you start talking about cancer treatment, external beam therapy does not leave you radioactive. Typically, that's like an intense X-ray that's targeting one area on the body, and once that X-ray is turned off, you're not radioactive anymore. But if you're pregnant, that's where you'd want to have those questions, because depending on what area of your body needs to be treated, that's where you'd want to ask those questions about external beam therapy. For breastfeeding, external beam therapy, even for treatment, should be okay. I would still ask,
sure,
just because it's good for them to know you're breastfeeding, and it's good for them, like you said, remind them that you're breastfeeding, make sure it's okay. But again, external beam therapy, once that beam is turned off, you are not still radioactive unless something has been implanted in you, which typically depends on the cancer, depends on the treatment. Sometimes there's an implanted seed, sometimes, and external therapy. It just depends on your specific situation. So it never hurts to ask the question.
And so radiotherapy, generally speaking, for cancer treatment in breastfeeding, tell us about that.
Yeah, for cancer treatment using radiotherapies, first of all, very effective, excellent tools. If you have a cancer, you should not shy away from it. It's saved many lives. That said, if you are breastfeeding and you are getting radiotherapy, and again, those three nuclides I touched on, especially the iodines, that's really where you're going to want to have a conversation, because there's a very high likelihood for certain isotopes of iodine that you're going to need to just stop breastfeeding for the safety of your child, because they have these teeny tiny little thyroids. Gallium-67 is being used less often. It's sometimes used as a tracer in PET CT, for example. And so again, for diagnostic tools, generally it's a small amount, but really it's going to be very specific to why you're having the scan and what they're looking for, the quantity that they're using. So that one is another one that, depending on the dose they give you, you may need to stop breastfeeding. Technetium is much safer. Technetium-99m is probably the most common injected radionuclide in the world. It's used in something like 85% of all nuclear medicine cases. So it's very widely used, very common, and it's much safer than iodine-131 or gallium-67 for breastfeeding, pregnant and breastfeeding women. That's where you maybe, just to be super cautious, you'd maybe want to pump in them for a day, 12 to 48 hours kind of thing. So much lower concern there. And part of that's because of the half-life. So technetium-99m has a half-life of 6 hours, meaning that every 6 hours, half of the original material is gone. So you can see how 12 to 48 hours, a significant amount of that material is just gone. So again, there's a lot of these things. I'm saying a lot of words. There's diagnostic, there's therapeutic. What about the amount? What about this isotope or that one? And, if you're going, oh my God, then that's okay. This information's out there, and it's for your specific case, it's better to ask the question, right? If you're not sure, it's always better to ask. If you're unsure about an X-ray, it's still better to ask, right? I mean, even if the answer is totally fine to breastfeed after an X-ray, you are not silly for asking. To never feel like you shouldn't be able to ask the question and get an answer from your provider. And if your provider doesn't know, reach out to MotherToBaby or to the HPS, the Health Physics Society, because we're happy to help with your specific case.
Absolutely. The communication is key. And again, thank you for saying it. It's not silly. Even if you're 99% sure and you just want to have that confirmation, go for it. Ask it. Your provider has heard it before. Health Physics Society has heard it before, and so has MotherToBaby. So please feel free to reach out with those questions. And speaking of questions, Dr. Caffrey, before we let you go, what is the most interesting question about radiation and breastfeeding that you have received?
Yeah, and this was a fun one. I was poking around my questions that I've answered, and we had this really unique case. So we had a veterinarian write in And she wanted to know if it was safe to participate in nuclear imaging of horses using Tech 99M. So it turns out, and this is an interesting one because veterinary medicine is taken off, and people are giving their cats iodine therapy. They're doing bone scans on their horses using technetium 99M. Who knew? So this woman, and it's one thing if it's, your cat and you're around one cat. It's a different thing if you are around a lot of horses that are getting a lot of Tech 99M, and you're doing the scans and you're hanging out with a horse and, it's potential bodily fluids or excrement. You're near that for a long time. And so her question was, is it safe to breastfeed if I'm doing bone scans, technetium 99M bone scans on horses all day, which is just a fascinating use case. So, and the answer of that is that technetium 99M is excreted mostly in urine. So if a horse pees, that's mostly where the material is going to be. And so she can, right? She can definitely still participate in this, do her job, that if she wants to, if she feels comfortable with that, she's still perfectly safe doing that. But she should take precautions. She should wear a protective gown. She should wear gloves. She should wear a surgical mask, watch out for splashes. So the other thing I would say is for women that are in the workforce, it's not an all or nothing, like, oh, if I say anything, I'll have to quit. It's use some basic precautions, learn some things, ask some questions, make an informed decision about what risk you're willing to accept. But for this person, it was just wear some PPE and, be careful if the horse pees.
That is interesting. I got to give you that. That's a good one. I always find animal related questions when we think about like human pregnancy and human breastfeeding, they are interesting and not always tricky, but you have to look at it a slightly different way. So I appreciate that all or nothing, because very often that's what we hear. It's like, I give dental x-rays and now I can't do that because I'm pregnant or breastfeeding. Is that correct? And so it's that individual risk assessment, right? It's that case by case basis. You had already said, what agent, how much, how long, what reason, what capacity, right? So it's always going to be something where we need to think a little bit more about it for every specific situation. Dr. Caffrey, lots and lots of good information today. Is there a final thought you would like to leave our audience with?
Yeah, and I mean, it's going to be the same final thought I think I left you all with last time, which is, radiation can be scary. You can't see it. You can't feel it. You don't, is that actually really off? What are you injecting in me? Those are totally normal questions to have. It's totally normal to be scared of radiation. That is very common. You're not weird. Always ask. And if in doubt, reach out to the Health Physics Society. You can find us at hps.org or through links on the MotherToBaby website. Expertise is available to help you, and not everyone on the internet is safe. So MotherToBaby is safe. Health Physics Society is safe. And we really want to be a resource for pregnant and breastfeeding women and be here to help.
Absolutely. Can't say it enough. There is information out there, good information out there, and knowing how to find it and who can help you is absolutely critical. So of course, we will have information about Health Physics Society in the show notes. And of course, you can always contact MotherToBaby as well. Dr. Caffrey, thank you so much for coming back, for giving us this information. We hope to have you again on a future show, but we really, really appreciate what you and the Health Physics Society are doing. Please keep up the good work.
Thank you so much. It's been a pleasure to chat with you.
And that's going to do it for this episode of the MotherToBaby Podcast. Be sure to hit that subscribe button so that way you never miss a new episode. And you can go back and listen or re-listen to some of those older episodes as well. You can find us on iTunes, Spotify, Audible, or however you like to listen to podcasts. And if you want to be on the podcast or if you have an idea for the show, we would love to hear from you. Please feel free to email us at contact@mothertobaby.org. And MotherToBaby is here to answer your questions about exposures before and during pregnancy, while breastfeeding, or if you have questions about exposures and adoption. You can reach us by phone at 866-626-6847. by text at 855-999-3525. You can visit us on our website, MotherToBaby.org, and there you can chat with an information specialist. You can look at our many blogs, information pages, our hundreds of fact sheets that are available free in English and in Spanish. And you can also listen to our podcast or find out how you can participate in our pregnancy studies. If you would like to support the Mother to Baby podcast, as well as all of the ways we get critical pregnancy and breastfeeding health information to you at home, we have a new way to do just that. Encircle is our new monthly giving society that helps ensure we can continue to provide our services at no cost. Join the community today and encircle parents and babies in health. Members will be recognized on the podcast and website. Visit mothertobaby.org/donate today. Until next time, remember, Mother to Baby is here for you. Take care.
Mother to Baby is a service of the nonprofit organization of Teratology Information Specialists and supported by the Health Resources and Service Administration of the U.S. Department of Health and Human Services. It's made possible through generous donations from listeners like you. To learn more about Mother to Baby, please visit mothertobaby.org.